Welcome back, or welcome for the very first time. I'm Nurse Eunice, and you're in the right place if your goal is to pass your CNA exam. This 100 question CNA practice test was created to help you think like the exam, build confidence, and walk into test day prepared, not overwhelmed. Before we get started, I want you to know that you have support. You can purchase the full written practice test that goes along with this video for just $7. So you can pause, answer the questions, and practice exactly like the exam. If you're looking for a complete study solution, our CNA exam prep workbook is available on our website, fltraining.com, or you can use the QR code that's on your screen. It is filled with practice questions, clear explanations, clinical skill steps, medical terminology, and so much more. We also include our CNA test tips to help you pass on your first attempt. And don't forget, our step-by-step CNA skills videos are right here on this YouTube channel to help you master skills with confidence and proper technique. This will be your year to pass your CNA exam. Stay focused, trust the process, and let's get started. Before you begin, find a quiet space to focus, have a notebook or scratch paper ready. Read each question carefully and trust your instincts. You already have the heart for patient care. If you like, you can also enter your answers in the chat. Question 1. Which action best prevents the spread of infection when assisting multiple residents? Is it A, performing hand hygiene between residents, B, wearing gloves all day, C, changing uniforms quickly, or D, opening windows? Yes, we're starting off with the easy ones and we're going to end with the hard questions. If you selected A, you're absolutely correct. Hand hygiene before and after each resident contact is the single most effective way to prevent the spread of infection. Gloves do not replace hand washing. Question 2. A resident with right-sided weakness should have their call light placed. Is it A, outside the room, B, on the right side of the bed, C, at the foot of the bed, or D, on the left side of the bed? If you selected D, you're absolutely correct. The call light must be placed on the resident's stronger side to ensure they can safely reach it when needed. Question 3. Who is responsible for developing nursing care plans? Is it A, certified nursing assistant, B, registered nurse, C, physicians, or D, physical therapist? That's right. I know you answered it correctly if you chose B, registered nurses. They are trained to create individualized care plans based on patient assessments, helping guide the care provided. Number 4, what information is typically included in nursing care plans? Is it A, medical diagnoses, B, doctor's orders, C, patient goals, or D, insurance information? When we ask you to follow the care plan, what are you following? What are you reading? I know this one's tricky. I know you want to choose A, medical diagnoses, but that's not correct. It may say what the diagnosis is, but you're going to be more concerned about the patient goals. It is C. Nursing care plans outline patient centered goals, interventions, and expected outcomes to guide the care provided by the healthcare team. Great job, guys. Question 5. Which of the following tasks is outside the scope of practice for a CNA? Is it A, taking a toddler's temperature, B, measuring blood pressure, C, filing toenails, or D, dressing a surgical wound? Which of the tasks are outside the scope of practice for a CNA? That's right. It is D, dressing a surgical wound. Yes, as a CNA, you can also work with kids. So you could take a toddler's oral temperature or a tympanic temperature, but what you can't do would be the wound care. Wound dressing is usually restricted to licensed nurses as it requires specialized knowledge to avoid infection and promote healing. Question 6. How often should a CNA reposition a bedridden resident to help prevent pressure injuries? Is it A, every 2 hours, B, every 6 hours, C, once per shift, D, once daily? That's right. We're moving right along. We're going all the way to question 100. And if you want to purchase the slides that correspond with this particular video, you can either do so directly from our YouTube store or by going to our website, which is at the bottom of the screen. Yes, that is right, everyone. It is A, every 2 hours. Repositioning every 2 hours or more often, if needed, if the patient complains of pain, reduces prolonged pressure on the skin and improves circulation. Question 7. If a patient has had confusion for many years, this is likely a chronic A, physical disorder, B, psychotic disorder, C, cognitive disorder, or D, palliative disorder. That's right. I require you to learn medical terminology. So if there's a word that you don't understand, I'm going to ask you to write that word down so that you have time to research it. That is right. It is C, cognitive disorder. Chronic confusion over prolonged period often indicates a cognitive disorder such as dementia, which affects memory and thinking. Number 8, which vital sign measures oxygen saturation in the blood? Is it A, pulse oximetry, B, blood pressure, C, body temperature, or D, respiratory rate? I'm seeing a mix of A's and D's, but it specifically asks which vital sign measures oxygen saturation. And so if you chose A, you have it. It is pulse oximetry. That would be the finger probe. Sometimes you may see them on someone's ear if they're a busybody, maybe even on their toe. But the pulse ox measures the percentage of oxygen in the blood and helps detect respiratory issues. Whenever you look at this monitor has a lot of different icons, a lot of visuals. And so where it says 60, that is actually the heart rate, and that would be the cardiac rhythm. Where it says 100 and you see that waveform, that one says SpO2. That one is measuring the oxygen within the bloodstream. However, sometimes that waveform could be chaotic, especially if your patient's moving. And that means that that number would be lower. So your goal whenever you're checking someone's oxygen level is for there to be a consistent waveform so that the reading is accurate. If the waveform is inconsistent, if it's kind of all over the place, either your patient's moving, maybe their fingers are cold, maybe you need to switch it from their dominant hand and put it on their non-dominant hand. And then of course at the bottom we have the blood pressure. And let's go to our next one. Question 9. How does a long-term care facility primarily differ from a respite center? Is it A, long-term care focuses only on physical care? B, long-term care provides extended care for residents? C, respite centers only offer outpatient services? Or D, long-term care excludes emotional care? Examples of long-term care facilities would be nursing homes, assisted living facilities. So yes, this becomes their new home. So the answer is going to be B. Long-term care provides extended care for residents. Remember, these are not patients. That's their home. That's their residence. So long-term care facilities are designed for residents who need ongoing care, whereas respite care provides short-term relief for primary caregivers So if wife has been taking care of her husband for years and she finally wants to go on a vacation up north to go visit the kids, she would put her husband in respite care, short-term care for the weekend or for a few days, and then she would come back and resume her caregiver duties. Question 10. What is the correct order for putting on PPE? And that is a lot to read. So I'm going to let you read it and I'll give you about 10 seconds to put your answer in the chat. All right, revealing the correct response in 3, 2, and that's right. It is A. It is gown, then mask, goggles if you're wearing them, followed by gloves. The rationale: your PPE or personal protective equipment must be donned, that means put on, in the correct order to reduce contamination risk. And so the image that is on the screen comes directly from the CDC, the Centers of Disease Control, and you can find that image there, or you can download the slides and get the image. But gown first, followed by mask, goggles or facial if you're wearing them, and the last thing you're going to don or put on would be your gloves. Question 11. Who are the primary recipients of hospice care? Is it A, children with genetic disorders, B, elderly patients needing surgeries, C, individuals at the end of life regardless of age, D, elderly patients? We have so many students from all around the world who utilize our resources online. And we also have educators who play our videos. And so if you're finding that me reading these questions to you is helping you understand terminology, helping you to answer the question, don't forget that when you take your test, you can request an audio test. They will give you an earpiece where your questions and answers are read to you. My goal is for you to pass the CNA test. I don't care how you pass it. I need you to pass it. So if reading isn't your strong point, or if English is your second language and the translations are sometimes hard, go ahead and talk to your professor, talk to your instructor, and ask if you can get an audio test versus the traditional test that would not be read to you. Great job, team. The answer is C. Hospice care provides comfort and support for those nearing the end of life, focusing on quality rather than curative treatments. 12. When caring for a resident with C. diff, Clostridium difficile, the CNA should A. Wear sterile gloves, B. Use hand sanitizer before leaving the room, C. Wear a mask only, D. Wash hands with soap and water. Your patient has C. diff. What does that mean? How does it impact your patient? How does that impact you? Well, when a patient has C. diff, they have a lot of watery diarrhea that is foul smelling and also very contagious. The C. diff is a spore. The hand sanitizer cannot penetrate it. So if your patient has C. diff, we're going to put them on contact isolation. You're going to have to wear gown and gloves when you go in to provide care, but you're also going to have to wash your hands because, again, hand sanitizer cannot penetrate that spore in order to kill it. So you're going to use warm water and soap in order to cleanse the germs off your hands. And then, of course, the friction is going to help remove it and wash it down the drain. So here's your rationale. Soap and water are required because alcohol-based hand sanitizers do not kill C. diff spores. 13. CNAs are not allowed to apply or perform which of the following? Is it A, body lotion to the feet, B, blood pressure cuffs, C, antibiotic ointment, or D, denture care? Which are CNAs not allowed to apply or perform? That's right. team. Great job, caregivers. It is C. Applying medications, including antibiotics, is outside the scope of practice for CNAs and requires licensed personnel, such as the LPNs or the RNs. And remember, next stop is nursing school. You can do anything for a year, and the CNA to LPN bridge is 1 year. And I know they're going to tell you, hey, CNAs don't go to LPN school because the LPNs are losing their jobs. Well, tell them that Nurse Eunice told you that she's been a nurse now for 27 years and she's not seen an LPN lose their jobs. It's just an easier route. See if you even like nursing. So CNA to LPN is 1 year. And then once you've been an LPN for a year, you can do the LPN to RN bridge. So either way, you're going to be an RN. It just depends on whether you want to go to school straight for a few years or if you want to learn and take steps that are more manageable. The choice is yours and it depends on how much family support you have. Question 14. After completing tasks such as emptying a drainage bag, what should a CNA do next? A, notify the family members. B, record that the task was completed. C, report directly to the medical director. D, disconnect the catheter tubing. You just emptied the drainage bag. What happens now? That's right. If you empty something and you don't document it, we have no proof that you did it. So it is B. Documentation is essential for all completed care tasks, helping ensure continuity of care and communication with the healthcare team. So continuity of care. If you don't document it, we won't have our 24-hour totals. We won't know if this patient's retaining fluid, if they are, if they're urinating too much. So you documenting helps us provide the best care for this patient. So after you do a task, complete it by documenting it. 15. Where can CNAs find a list of tasks they are legally allowed to perform? Is it A, state laws and regulations, B, federal laws only, C, nursing home policies, or D, medical board guidelines? And this is particularly important for those CNAs who like to travel. So there is a role for travel CNAs who travel to different states. They take short assignments, 12 weeks. But whenever you're in a new state, you have to know the state's laws and regulations. So the answer is A. The scope of practice for CNAs is regulated at the state level. So state-specific laws state-specific laws outline their permissible tasks. 16. Which of the following tasks can a CNA legally perform? Is it A, provide wound care for pressure sores, B, administer medication, C, insert a urinary catheter, or D, measure blood pressure? Which one of these would be within your scope of practice? That is right. You can take a blood pressure reading. The answer is D. CNAs are trained to measure vital signs like blood pressure, pulse, respiration, and temperature. But tasks like wound care, inserting catheters, or administering medication are outside their scope of practice. And I know that in states like in Florida, you can take a medication aid course once you've been a CNA for a year. And then that would allow you to pass medications in assisted living facilities, in group homes. When you're taking your CNA test, that is not you. That is not your role. So for your CNA test, your scope of practice always is that you cannot administer medications. 17. When documenting care, a CNA is responsible for recording A, the care that the nursing team provides, B, all patient diagnoses, C, only the care they provided, or D, medication administration. Well, we know it's not D. All right, so process of elimination, is it A, B, or C? What are you responsible for recording? That is right. You only record the care that you provided. So if the outgoing CNA is rushing and she's like, hey, I didn't put these vital signs in, would you do it for me? No, I cannot. I'm only going to document the vital signs that I actually record. So CNA should only document the care they personally provide to ensure accurate records and accountability. 18. When a CNA measures urinary output, where should they document it? Is it A, vital signs flow sheet, B, nurse's note, C, intake and output form, D, patient's chart? All right, revealing the correct response in three, two, and you document urine output on the intake and output form, the INO form. So the answer is C. Urinary output is recorded on the INO form to monitor the patient's fluid balance. My goal would be what goes in should match what comes out. So if your patient had 240 cc's of fluid or 8 ounces of fluids with breakfast, by the time it's 2 hours later, going to be taking them to the bathroom, I want to see about 200 mLs or cc's of urine being produced. That is what we consider balance. If a patient's drinking but not urinating, that's an issue. Okay. All right. So that is what your INO form is for. And that's how we do our checks and balances in order to make sure our patients stay healthy. 19. What is the normal adult respiratory rate? Is it A, 6 to 20 breaths per minute, B, 6 to 12 breaths per minute, C, 12 to 20 breaths per minute, or D, 12 to 30 breaths per minute? And that's right. Once you download these slides and you practice with your CNA buddies, they're going to be like, "You're so smart. How did you know all this?" Tell them that you studied with Nurse Eunice. So that is right. It is C, 12 to 20 breaths per minute. That would be the normal adult respiration range. Great job, team. You have to know what's normal so that you can notify me if something is abnormal. 20. Which symptom may indicate a urinary tract infection or a UTI? Is it A, dysuria, B, clear urine, C, normal urination frequency, or D, increased appetite? That's right. You will not hang around me and not learn your terminology. And so, if you chose A, you are correct. You understand that dysuria, the DYS, that prefix refers to pain, difficulty, burning as it relates to urine, urea. So, let me read the rationale. Dysuria refers to pain or burning during urination and is often a common sign of a urinary tract infection. CNA should report this symptom to the nurse promptly. 21. If a patient who recently fell is now receiving balance exercises, which professional is likely helping them? Is it A, a social worker, B, an occupational therapist, C, a balance therapist, or D, a physical therapist? All right, I see some varying answers coming through. We're torn between C's and D's. But the D's have it. Yes, it's going to be a physical therapist. If there is a such person as a balance therapist, I don't know who they are. That's just something I made up. So, a physical therapist focus on exercise and therapies to improve mobility and balance. Once your patient balance or their equilibrium improves, they should experience less dizziness and less falls. 22. Who would most likely assist a stroke patient with adaptive devices for eating? Is it A, an occupational therapist, B, a physical therapist, C, a speech therapist, or D, a social worker? And I see a question about buying our study guide if you're in another country. When you go to our website, it's going to take you to our Amazon store. And yes, our book would ship anywhere that Amazon ships. So, yes, you can purchase it from YouTube. That may be limited to the United States. But if you go to our Amazon store, you can purchase it in Africa, in Asia, in India, wherever you are. And we appreciate you for your support. So it's going to be A, an occupational therapist. Occupational therapists work with patients on daily activities. They help them with their fine motor skills. They help them move their hands again, learn how to eat again. And it may provide adaptive devices to assist with eating and other tasks. And so what you see there on the image would be weighted utensils with a larger handle. So imagine somebody with Parkinson's disease or with severe arthritis of the hands. They're going to have a harder time feeding themselves with a traditional utensil, such as a spoon or a fork. And so this is what an occupational therapist will help them with versus a physical therapist. So you think physical therapist, think someone broke a bone. They now need to learn how to walk again. An occupational therapist is going to teach you how to do your ADLs, how to brush your teeth again, how to button your clothes again, how to safely feed yourself without all your food falling off your spoon. 23, which pulse site is located on the wrist? Is it A, carotid, B, radial, C, femoral, or D, popliteal? And if you don't know where those pulses are located, I need for you to write some notes so you can go back and study them later. But you all who've been with me for a while, you understand that the pulse that's located at the wrist is going to be B, radial. Look at the image. It's beneath the thumb. And so the radial pulse is palpated on the thumb side of the wrist. And if you look at our skills video, yes, we have a skills video that shows you how to take the pulse, the blood pressure, respirations. You're in good hands with Nurse Eunice and Florida Training Academy. 24, which action helps reduce the risk of aspiration during meals? Is it A, positioning the resident supine, B, feeding while lying flat, C, rushing the meal, or D, positioning the resident in the Fowler's position? Hmm. All right, I was only able to trick one of you all. And so supine and flat, so both A and B are the same exact answers. I just want to make sure you understood what supine meant. When someone is in the supine position, take the U out, they are lying on their spine. That's going to increase the risk of aspiration, not decrease it. So yes, for all of you all who chose D, you have it. We're going to sit that patient upright. We're going to put them in a Fowler's position because the upright positioning allows safer swallowing and reduces aspiration risk. Question 25. A pulse oximetry reading of 88% indicates A, normal oxygen saturation, B, high oxygen level, C, low oxygen level, D, slow respiratory rate. Can only answer what the question's asking. So it's not D. It did not mention what the respiratory rate was. It told you what the oxygen saturation was. Okay, someone could be hypoventilating. They could be breathing fast. So because a pulse ox reading is 88 doesn't mean that they're breathing slowly. Okay, it could be the opposite. They could be breathing normally. So for those of you all who chose C, you got it. Oxygen levels below 90% are considered low and should be reported promptly. And a good rule of thumb is that a normal oxygen saturation for a patient should be greater than 95% unless your nurse or the care plan says otherwise. Because there are patients with COPD, chronic obstructive pulmonary disease, and we're okay with their O2 sats being 92%. But I don't ever want you to guess that as a CNA. When in doubt, you talk to your nurse, you read that care plan, because no one should just normally be sitting around 90% and no one on a nursing team is made aware. So let your nurse know, and then he or she should do like I do. They should educate you. Question 26. If a nurse assigns you to empty a patient's urinary drainage bag, what should you do? A, refuse the task as it's not a CNA's responsibility. B, disconnect the catheter tubing. C, complete the task and report it to the nurse. D, kink the tubing before emptying the bag. Awesomeness. You all get it right. Yes, that's within your scope of practice. It is C. You're going to complete the task. And I know here it says reported to the nurse. You would document it. Unless there's something abnormal, there's nothing to report. You're going to document it, put it in the chart. And then that way I can go back and see what that output total was. So emptying the urinary drainage bag is within the CNA scope of practice. It's essential to complete the task and communicate with the nurse for continuity of care. 27. The medical term for difficulty breathing is it A, tachypnea? Say it with me. Tachypnea? Is it B, apnea? C, hypoxia? Or D, dyspnea? Now, I just taught you prefixes. So I expect everyone to get this answer right. All right. And just because someone has tachypnea doesn't mean they have difficulty breathing. If someone just got through running, their respiratory rate will be higher. Thus, they would be tachypnic. It doesn't mean they're having difficulty breathing. Apnea, anytime you put A in front of a medical term, is the lack of. So apnea is not the difficulty of breathing. They're not breathing at all. Start CPR. Hypoxia refers to the oxygen saturation. So yes, the answer is D. Dyspnea refers to shortness or difficult/labored breathing. You'll oftentimes see that with someone who has congestive heart failure or pneumonia or asthma. So that's different from tachypnea. This person's struggling to get air. 28. A CNA should report which blood pressure reading immediately. Is it A, 140/80, B, 116/68, C, 88/48, or D, 100/56? Which one are you hitting that call button really fast for? That's right, Sharon. That's right, Michael. It is C. All right, let's go back and look at the others. 140/80, that's high normal. Okay, it's not 200/100. So you're going to let your nurse know, but that could be that patient's normal. Plus they're stressed and they're in the hospital. So 140/80, tolerable. 116/68 is a good blood pressure. 100/56 is on the lower side, but maybe this patient was given pain medications. Maybe they're dehydrated. You're going to let your nurse know, but technically your systolic is anywhere from 100 to 140. So that systolic blood pressure is still good. The diastolic's a little bit low. So yes, you're going to tell your nurse, but the one that's 88/48, oh, don't stand that patient up. They have to stay in the bed, because if you stand them up or do anything with them, they're probably going to pass out. So a blood pressure of 88/48 is abnormally low and may indicate hypotension. Get your nurse in that room. 29. Which abbreviation means before meals? Is it AC, PC, BID, or PRN? And for anyone who wants me to do another video on medical terminology, I need you to put MT in the chat. Put MT in the chat. I'm going to get all those notifications, and my staff is going to be like, what does MT mean? I'm going to be like, oh, they want a medical terminology video. All right. So for question 29, the answer is A. AC is the medical abbreviation meaning before meals. Let's discuss the others. PC is after meals. BID is twice per day, and PRN is as needed. So let me just read them again. AC, before meals. PC, after meals. BID, twice a day. PRN, as needed. 30. Which prefix means slow? Is it A, tachy, B, Brady, C, hyper, or D, hypo? So I've been doing this for a long time. I've been teaching these classes now for 17 years. And I can tell you that if you are failing a written examination, you're failing it because you don't understand medical terminology. You're trying to memorize words. You're trying to, memorize test questions. You have to learn this. You have to write it down. You have to get some flashcards. We even have flashcards on our website. There's no reason for you to fail this test. Get you some study buddies, watch our videos, understand the terminology, because when you're in the hospital, we're not going to just say, oh, his heart rate's low. You're going to hear us say the patient has bradycardia. Brady referring to slow, cardia referring to the heart. So the answer is B, Brady is slow. And so you'll hear that with bradypnea, which means that their respiratory rate is slower than it should be. So anytime you see Brady, it's slow, tachy is fast, A is the absence of. 31, in a care conference, who is most responsible for the patient's care plan? Is it A, the patient, B, the nurse, C, the doctor, or D, the CNA? Who is most responsible for the patient's care plan? I know you want to say it's the doctor, but the doctor just wrote the orders, did the diagnosis, gave the diagnosis, did their assessment, and now it is the nurse who carries out that care plan. So the answer is B. The nurse typically leads the development of care plan, incorporating input from other team members to ensure the patient's needs are met. 32. Who should attend a patient's care conference? You'll often see this at assisted living facilities and nursing homes. So, and also when you're taking your CNA examination, don't assume that you're working in a hospital. You are anywhere where an elderly or an adult patient or resident would be. That could be skilled nursing, it could be hospital, it could be nursing home. So when you're taking your test, especially if you're already working in a hospital, I need for you to kind of leave what you know behind and just take this test with fresh eyes. So who should attend a patient's care conference? Would it be A, only doctors and nurses, B, only CNAs, C, the entire healthcare team and the patient, D, only the patient's family? That is right. It is C, collaborative care. We have to include the patient and we need you there. You know how much information you have. You know more about that patient than the nurse does. You know more about that resident because you're always with them. So a care conference includes the healthcare team, the patient, often family members, the CNA, the nurse, the doctor, the case manager. We all get together and we discuss all aspects of care to make sure that that resident, that patient is receiving the best care for them. 33. A CNA enters a resident's room and observes the resident sitting upright, gasping for air, and clutching their chest. What is the CNA's priority action? A, leave the resident and get the nurse. B, obtain vital signs. C, reposition the resident. D, stay with the resident and call for help. This one's tricky. How scary. You go into a resident's room, they're gasping for air, they're clutching their chest, and you are going to be the difference as to whether or not this person receives immediate care and treatment or if their condition gets worse. And for everybody who chose D, you are absolutely correct. You're going to stay with the resident and call for help. You can sit them up afterwards. You can take the vital signs afterwards. But right now, we need the nurse. We need the rapid response team. We need emergency care. So in an emergency, the CNA's priority is to ensure safety by staying with the resident and immediately calling for help. Repositioning, vital signs, and documentation come after help is called. It literally takes you 2 seconds to hit that button. So it's not like you're delaying care. You're going to hit the button. You're going to be calling out for that nurse. You cannot leave that patient. You can sit them up. If there's equipment to do the blood pressure, the pulse ox, you put all that on the patient. That way, when your nurse gets into the room, we at least have a better clinical picture as to what's going on with that patient. 34. A CNA is caring for 4 residents. Which task should the CNA complete first? A, refill a water pitcher. B, assist a resident who is dizzy when standing. C, make an unoccupied bed. D, answer a non-urgent call light. So a non-urgent call light, an example would be someone who's calling you to change the station on their TV. That is right. Safety, safety, safety. When you're taking a CNA test, it's all about patient safety. And so your priority is going to be that patient who is most likely to fall. So the answer is B. Dizziness indicates a high fall risk and is the safety priority over those routine tasks. You can always go and make an unoccupied bed. The patient's not in it. And if the patient, even if the patient had an accident in the bed, bowel movement or urination, your patient who is, a fall risk is still the priority for right now. And so my thing that I do the take care of the patient who was falling, a fall risk, not falling. And then I would go fill that water pitcher really fast. I would then answer that non-urgent call light. Okay, she's already called. It's non-urgent. I'll take care of whatever she needs. Then the last thing I do is make an unoccupied bed. 35. Which observation should be documented and reported? A, new redness over a bony area. B, resident watching TV. C, normal appetite. Or D, regular sleep pattern, which should be documented and reported. So it's just not, and actually it's kind of the opposite. You report it and then document it because you want to, in your documentation, state that you notified the nurse. And so it's A, if your patient has new redness over a bony area, you're going to report it and document it because redness may indicate early pressure injury and requires intervention. And I know our books are mostly geared toward the Western population. Caucasians are in the books a whole bunch. I need you to know that you have brown patients too, and your brown patients don't turn red. So if your patient's skin appears to be grayish, if it's darkened in the area, if there's an area on their skin that does not look like the surrounding color, that could be the sign of a pressure ulcer on someone who is not Caucasian. So you're taking care of all races, and not all races turn red. 36. A resident with dementia becomes suddenly agitated and attempts to climb out of bed. What is the best CNA action? A, calmly direct the resident and stay nearby. B, apply restraints. C, leave the room to get supplies. D, raise all side rails. Somebody who has dementia, they're agitated suddenly, and they're trying to climb out the bed. What do? I know we're torn, right? All right, so I know you're not going to like this answer. The answer is not D. The answer is A, calmly redirect the resident and stay nearby. CNA should use the least restrictive interventions first. Calm redirection helps maintain safety and dignity. So let me tell you why it is not D. D and B both require a physician's order. You cannot put all 4 side rails up without a doctor's order. You cannot apply restraints without a doctor's order. So if your patient suddenly becomes agitated, they could have a low oxygen level. Their blood sugar could be low. So you're going to calmly redirect. You're going to stay nearby. And guess who you're calling? That is right. You're getting that nurse in the room so she can do her assessment. So the correct answer is A, even though you wanted to choose D. And plus, if someone is confused and you raise all 4 side rails, they're still going to attempt to get out the bed. And now they're going to fall from a higher distance because now they've climbed over the side rail. So the best thing is just to stay with them until that nurse comes. 37. A resident has diarrhea and is incontinent. What is the CNA's priority action? Is it A, notify the nurse? B, apply powder after the bath. C, clean and dry the skin promptly. D, limit fluids. Your patient has diarrhea and is incontinent. Now, it didn't say incontinent of what. So I don't know if she's incontinent of just stool or is she incontinent of stool and urine. But what we know is it's a mess. Your patient is wet with urine and or fecal matter. What is your priority action? Don't call me. So the answer is not A. That's right. It is C. I need you to clean them up. So clean and dry the skin promptly. We don't use powders, you all. So immediate skin care prevents breakdown and infection. And let me just preference that by saying we don't use powders that are not prescribed. So we're not going to be putting talcum powder or whatever it is on a patient. So all that baby powder and stuff we don't use. There are medicated powders that a physician would order, and then your nurse could apply that. But that's not something that's within the CNA scope of practice. 38. An OSHA survey in a healthcare facility focuses on A, CNA certification, B, patient's rights, C, nursing licensure standards, D, health and safety practices in the facility. So you have to know what these acronyms mean. What does OSHA stand for? Right, so Occupational Safety and Health Administration. Occupational, workplaces. Is your workplace safe? That's your answer. So it is going to be D. That's right. So OSHA surveys ensure the healthcare facilities follow health and safety standards to protect both patients and workers. Example, needle stick prevention. Are there sharps containers? What type of devices do they add to the IV catheters, etc., to prevent a needle stick? So think of, if there's an accident or an incident that involves an employee, OSHA may be coming to that facility. 39. A resident is incontinent of urine. What is the CNA's priority? A, limit fluid intake. B, take them to the bathroom more frequently. C, inserting a Foley catheter. D, ignore the episode. Yeah, you're just going to leave them wet, huh? Just going to leave their skin wet. You're just going to ignore it. Oh, she's going to use the bathroom in the bed again. Or are you going to prevent it? That's right. Prevention is the key. So if I don't want you incontinent, if I don't want you wet, guess what I'm going to have to do as a CNA? B, I'm taking you to the bathroom. Come on, Miss Eunice, let's get on up. Let's go to the bathroom. So scheduled and frequent toileting is a key CNA intervention to reduce incontinent episodes, protect skin integrity, preserve dignity. No one wants to be wet, okay? And if they're wet, their skin is going to break down. They're going to get pressure sores. And it also lowers the risk of moisture-associated skin damage and urinary tract infections. Great job. I'm so proud of you. Question 40, and we're going all the way to 100. Look, if you've been here this far and you've not hit that like button, if you haven't told a friend that you're studying with Nurse Eunice, what are you waiting for? Go ahead and share, like, and subscribe. All right, so question 40. A resident perspires heavily during sleep. Which CNA action helps to prevent skin irritation? Is it A, applying lotion to moist skin, B, limiting fluids before bedtime, C, changing damp linens and clothing, D, covering the resident with extra blankets? Look, if I'm perspiring and you put extra blankets on me, I'm going to follow you to that nurse's station. You will not have a good night at work. So it's not D. And even though I didn't address this on so many other questions, unless there's a doctor order, you never limit a patient's fluids. That could be neglect. Okay, so we're not going to treat them like they're toddlers and take their fluids away. So if someone is sweating profusely, that's right, we're going to get them dry. We're going to change those damp linens and clothing, maybe give them, a moist washcloth or something, just for like their face. So moisture increases skin breakdown risk. Changing those damp items will keep the skin dry. Why would someone be sweating? Maybe they're overheated. Maybe they're fighting an infection. Maybe it's a woman going through menopause. So hormonal changes also will cause someone to break out into sweats. 41. Which of the following is an important sign that a patient may be experiencing silent aspiration? Is it A, coughing or choking during meals? B, complaining of difficulty swallowing? C, sudden drop in oxygen saturation without coughing? Or D, vomiting after eating? Notice it said silent aspiration. Coughing and choking, those are not silent. You're going to hear that. So that is right. Silent aspiration can occur, and it's going to be C. It's a sudden drop in oxygenation, usually after someone stopped eating. So let me read the entire rationale. Silent aspiration occurs without obvious signs like coughing or choking, but may result in a drop in oxygen saturation. Recognizing subtle signs is critical for early intervention. So after your patient's eaten, and now you're like looking at their saturations, they're starting to decrease, you're trying to figure something out. Maybe this person aspirated, and you weren't in the room. So that's a possibility, which is also why we ask that you keep a person sitting upright after they eat for about 30 minutes to prevent aspiration risk, to prevent the regurgitation or the GERD, or gastric reflux disease. And so you're going to sit them upright while they're eating. You can lay them back a little bit for about 30 minutes, but if they want to go flat, you need to make sure their food has fully digested. So about 30 minutes after their meal, if they're requesting to lay down flatter, you can do so. 42. During a state survey, if a surveyor asks you how you perform a procedure, how would you respond? Would you refuse to answer? Would you say that everyone does it differently? Would you refer the surveyor to the nurse? Or would you describe how you perform the procedure? I tell you, when those state surveyors come, everyone's on their P's and Q's. Your facility is going to be fully staffed. Everyone's going to be so nice. And the surveyor is going to pull you to the side and they're going to be asking you a question. And you know what you have to do? It's going to be D. I know we try to hide, but that doesn't always work. You're going to describe how you perform the procedure. Responding accurately about procedures demonstrates understanding and compliance with care standards because your facilities are supposed to train you. They're supposed to have skill days and they're supposed to have mock codes and drills, etc. And so if everyone's being trained according to the same standards, what you say should not get your facility in trouble because they've taught you their way. 43. Which CNA action best helps prevent pressure-related discomfort for a wheelchair-bound resident? Is it A, ensuring proper seating alignment? B, leaving the resident seated all day? C, massaging reddened skin? Or D, placing a pillow in the seat of the wheelchair? Oh, we're all over the place with this one. I see A's, C's, and D's. You never massage something that's reddened or irritated. Okay. You don't want to be massaging that. It's going to cause the skin to break down more. So is it A or D? Okay. And I see you all put in D. So you put a pillow in the seat of the wheelchair. Do you know how thin those hospital pillows are? Are they anything that's really cushioned? And now your patient has this pillow and they're still seated improperly. They're still going to get a pressure injury. So the best answer is going to be A. That's right. Proper alignment reduces pressure points and improves comfort. 44. Which CNA action best prevents infection when handling soiled linens? Is it A, shaking linens before bagging? B, sorting linens in the hallway? C, holding linens away from the uniform? D, placing linens on the floor? We want to prevent infection. It is C. Nothing touches you and you don't touch anything either. So keeping linens away from clothing prevents contamination. How can you keep linens away from your clothing if you're making a bed and every time you touch the bed, your leg touches? So just keep that in mind. When you're handling linens, nothing should be touching you. You don't fold towels and stuff and use your scrub top while you're doing that. Nothing should be touching you. That's going to keep you clean enough to take care of all of your patients. Because once your uniform is contaminated, you're contaminated for the rest of the day and you're taking those germs via your uniform from patient to patient to patient. Question 45. If a physician requests a CNA to perform an untrained procedure, the CNA should respond by A, saying, I'll try it, B, attempting the task discreetly, C, declining and seeking assistance from the charge nurse, D, completing it but not reporting it. Physician just wants to give you an opportunity to do something that you're not trained to do, which could risk your patient's safety, and it could end up with you being in jail. So we're not even talking about you losing your CNA license. We're talking about jail time. So the answer is C, you're going to decline it. That's not within your scope of practice. CNA should not perform tasks outside their training or scope. Instead, they should seek guidance from a supervising nurse, such as you should not be using a Hoyer lift by yourself. A CNA recently did that, and the patient ended up falling and dying. I don't care how short-staffed your facility is. You cannot use a mechanical lift by yourself. Leave that patient in the bed, document the reason why you couldn't do it or that you asked your nurse for help. Your nurse did not help, so that's why that patient's in the bed. You can still reposition that patient. You can turn them in the bed, but don't do anything that's going to jeopardize the safety of your patient or jeopardize your freedom. 46. In long-term care, the CNA's role often includes A, clipping fingernails, B, changing sterile dressings, C, diagnosing residents, D, reporting directly to the physician, E, assisting with daily activities, and providing emotional support. Stop trying to give me two answers. Only one answer is correct. And no, you can't clip fingernails. And no, you can't change sterile dressings. And no, you don't diagnose. And no, you don't report directly to a physician. You report to the nurse. So the only thing from that list that you can do is E. CNAs in long-term care assist residents with activities of daily living or ADLs and provide support promoting overall well-being. 47. A resident has a Foley catheter. What should the CNA ensure? A, the drainage bag stays below bladder level. B, the tubing is kinked. C, the bag rests on the floor. Or D, the catheter is disconnected. That's right. So when you're taking care of a patient who has a Foley catheter, you want to always keep that bag below the level of the bladder. If not, you can cause backflow, and that old urine can flow back into the urethra, the urinary tract. You can give them a UTI. So keeping the bag below the bladder prevents the backflow and infection. For the other options, look, we're not going to be kinking the tubing unless the nurse tells you to do so. Usually we are unkinking the tubing because our patients are Houdinis and they're moving in the bed and they're kinking their catheters. The bag should never be on the floor. That's a direct path for germs from the floor to travel up to your patient's urethra. Okay, so the bag should be on the frame of the bed, not on the side rail. That's where it's going to be placed. And then if the catheter is disconnected, that's a medical issue. That's an emergency. If it becomes disconnected, you can connect it quickly, but then your nurse is going to more than likely have to come into that room and change out that entire catheter system. It rarely happens, but it does happen. Question 48. A resident who is scheduled for a procedure asks the CNA for water. The resident has an NPO order. Which response by the CNA demonstrates effective communication? A, you can't have anything because the doctor said so. B, NPO means nothing by mouth due to aspiration risk during anesthesia. C, right now you can't eat or drink to keep you safe for your procedure, but I can help with mouth swabs to keep you comfortable. D, you'll have to ask the nurse about that. Effective communication. So even when you're communicating, you don't go beyond your scope of practice. So which answer sounds compassionate, addresses the patient's question, but prevents you from crossing over into the role of a nurse? That is right. It is C. So this response uses simple, clear language, avoids medical jargon. You're not going to go and tell a patient they're NPO. They don't know what that means. So you know what the acronym, the abbreviation means. They don't. It acknowledges the resident's discomfort and offers a safe alternative within the CNA scope. Effective communication helps residents understand and follow care instructions while maintaining trust and dignity. 49. Which of the following should a caregiver avoid when providing oral care to a patient without a gag reflex? A, using a suction device to remove excess secretions. B, ensuring the patient is positioned on their side. C, using a soft toothbrush to clean the teeth and gums. D, offering a sip of water to rinse the mouth. And the question asked, which of the following should a caregiver avoid? So only one answer. That is right. It is D. You're not going to give them a sip of water. They don't have a gag reflex. They're going to choke. So a patient without a gag reflex may aspirate water if offered to rinse their mouth. You can suction them. You're going to have them on their side, and you're not going to be using a toothbrush. You're going to use an oral swab. Gentle cleaning are the safest options to prevent aspiration during oral care. And even though your patient may be unconscious, unresponsive, you still have to perform oral care on them, because if you don't, I've seen videos where people have had maggots, growths within their gum line. You still want to perform this oral care, because if their mouth is germy, that's a direct path down to their lungs. So they're going to get an infection in their lungs. You have to provide oral care even if your person is unconscious. And this is a reminder that if you want to help support us, if you want a complete study package, I need for you to go to either our website, you can go into the YouTube store that's down below, or you can scan this QR code. You all, I have created I think this is the best CNA study guide on the market right now. It's easy to read. Pretty much I use my tone of voice throughout the entire book. We have real world CNA scenarios. We have step-by-step clinical skills. Of course, there are practice test questions. It's medical terminology. And for the videos, we have the QR codes embedded. So if we're talking about mouth care and you want to go and look at that skill, you can do so. So this is your all-in-one resource to help you pass the CNA exam, regardless of where you are located. Question 50. If you miss your scheduled break by 15 minutes, your best action is to A, leave for break immediately. B, ask another CNA to cover your task. C, skip the break and keep working. D, check with the nurse before taking a delayed break. Yes, the answer is D. It's best to check with the nurse to avoid interrupting patient care and to ensure proper coverage. Believe me, you're going to get your break. They just may have to, wait until another CNA is off of their break first. Okay, so try to keep to your schedules, but we know that the patient is the priority. 51. Which task helps prevent infection during perineal care? A, skipping gloving. B, cleaning from back to front. C, using the same wipe repeatedly. D, cleaning from front to back. And so the task that helps to prevent infection during perineal care or cleaning of the genitals is going to be D. Cleaning from front to back, from the cleanest towards the dirtiest. So the rectum is the dirtiest. So we always wipe the rectum area last. Front to back cleaning prevents bacteria from entering the urinary tract. 52. A resident frequently removes their oxygen tubing. Which CNA action helps to prevent complications? Is it A, taping the tubing to the resident's face? B, turning off the oxygen? C, removing the device? D, ignoring the behavior? Or E, checking tubing placement regularly? Now, I know what you want to do. You want to do A because you've seen that in practice. You can't be putting tape on these patients' skin, especially on their face, because sometimes when you remove the tape, you remove their skin. So that would not be a CNA duty. It is going to be E. You have to move a little faster. You have to get in that room, have to keep reminding them to put their oxygen on until that nurse can find a solution. So regularly checking oxygen tubing helps to ensure proper oxygen delivery, prevents interruptions in therapy, and allows the CNA to correct simple issues within the scope without causing skin injury or removing the prescribed oxygen. 53. Which behavior may indicate pain in a nonverbal resident? A, grimacing or guarding. B, smiling. C, normal posture. D, elevated heart rate. E, both A and D. That is right. You are absolutely correct. I saw some of you went back and you changed your answer, and you're allowed to do that. So the answer is E. Nonverbal residents may express pain through facial expressions such as grimacing, or maybe they're holding their arm, guarding, and then the physiological changes like an elevated heart rate, both of which are common indicators of discomfort when a resident cannot verbally report pain. So, as a CNA, you're looking for those nonverbal cues to let you know if your patient's okay. If they're resting, vital signs are normal. Well, if they're nonverbal, they have the smiling indicator. You would put that, maybe they're smiling. But now, if they're grimacing, they're crying, they may not be able to verbally express themselves, but you can see this person's in distress. Well, you're going to report that to your nurse. 54. What is the primary goal of palliative care? Is it A, correct behavioral issues, B, improve performance in daily activities, C, reduce food intake, or D, provide comfort and relief from symptoms? And this one should be easy for you all because we've already discussed it. Yes, it is going to be D. We're going to provide comfort and relief from symptoms. Remember, whenever they're on hospice, they're receiving palliative care. We're not trying to cure them. We've accepted the fact, this patient and their family has accepted the fact that they have a terminal condition. We want to keep them comfortable. So palliative care focuses on comfort and quality of life for patients, especially those with serious or terminal illnesses. 55. Which action should a CNA take to help prevent constipation? A, limit fiber in the diet. B, encourage adequate fluid intake. C, discourage movement. D, delay toileting. Great job, team. That's right. We're going to encourage adequate fluid intake. We would not limit their fiber. We'd give them more fiber. So fiber and fluids and activity, get them moving around. That's going to help soften the stool and promote normal bowel function. 56. If a nurse offers to let you insert a catheter to learn a new skill, your response should be A, accept the offer to gain experience. B, watch another CNA do it first. C, perform the task but don't tell anyone. D, refuse as it is outside your scope of practice. And this is something you were always curious about. You always want to know how to do this. And now you have this super cool nurse, and Nurse Joe is like, hey, come here. I want to show you how to insert this catheter. And what's going to be your answer, everybody? Say it with me. No. You're going to do D. You're going to refuse because it's outside your scope of practice. And what Joe is doing is setting you up, because Joe is going to be sitting there at his computer making his $75 an hour and asking you, hey, remember last time you inserted that catheter? You did such a great job. Go ahead and insert another one. So no, inserting catheters is not within the CNA scope of practice. So it's important to decline and maintain professional boundaries. Now, once you are a CNA, you have your license, and you go and you apply at a hospital. A hospital has a position known as a patient care tech, a patient care associate is some type of term for a hospital level CNA. The hospital may then train you to do catheters. Remember, for your CNA test, you don't do anything invasive. You don't insert catheters, but you do take care of the catheter once it's inserted. For your CNA test, you don't do wound care. For your CNA test, you don't do sterile gloving. For your CNA test, you don't insert IVs. Once you're in this hospital and they change your title, they may also change your job duties. But right now, you're not there. We have to actually get you to pass this test so you can get that hospital job. All right, so next, everybody, 57. Which CNA action best prevents contractures? Is it A, limiting movement, B, encouraging proper positioning. C, keeping joints flexed. D, avoiding limb support. And you're going to see this before the nurse will sometimes, especially in long-term care. There may be one LPN and you both have 30 patients, one LPN and two CNAs, and you're going to see something that doesn't look right. I need for you to go ahead and try to take care of it until that nurse can get there. And so you're going to use pillows. If they have braces, you're going to make sure they have their braces on. You have to ensure proper positioning. So yes, the answer is B, because once that joint gets fixated like that, once it gets locked, that's from lack of range of motion. That's from improper positioning. And looks like this person had like a severe burn on their arm. So there was some other, etiologies that may have happened before they got contracted like that. But you can help prevent that. A contracture is the stiffening and shortening of muscles or joints that limit movement, often caused by a lack of movement or poor positioning. So CNAs help prevent contractures by maintaining proper positioning, supporting the limbs, remember those braces and those pillows, and encouraging safe movement during daily care. Proper alignment keeps joints flexible and reduces stiffness. 58. A CNA disagrees with a nurse's instructions for resident care. What is the most appropriate action? A, refuse to follow the instructions. B, complain to the other staff. C, follow the instructions and address concerns appropriately later. D, post about the issue on social media. Good. You don't have to agree with that nurse, but respect them. So the answer is going to be C. Okay, you're going to send them, so you're going to see them again at another location. Right now, you don't understand everything. I know that you think you understand everything, but you don't, and we're part of a team. And so you want to follow that nurse's instructions as long as it's something that you can do within your scope of practice. So CNA should follow directions to maintain resident safety and address concerns through the proper channels. 59. Before transferring a resident from a wheelchair to a bed, what should you check? A, ensure both bed and wheelchair wheels are locked. B, make sure the bed wheels are unlocked and the wheelchair wheels are locked. C, leave both bed and wheelchair wheels unlocked. Or D, lock the bed wheels but leave the wheelchair wheels unlocked. That was a lot. Whew. For the answer to simply be A, you make sure everything's locked. You do not want to move your patient if something is unlocked. When you take your CNA test, of course, we have a video on transferring from bed to wheelchair. But after you do your introduction, you've washed your hands, you gather your supplies, you put that wheelchair at the side of that bed, you lock those brakes, okay? That will be a failing point. So locking both set of wheels ensures stability during the transfer, thus reducing the risk of falls. 60. Which action by a CNA would be considered insubordination? A, asking for clarification. B, reporting concerns through proper channels. C, refusing a reasonable assignment. D, following the care plan. That's right. Refusing a reasonable assignment. So the answer is C. Refusing assigned duties without cause is considered insubordination. I know you normally work on Hall A, but today we have another CNA working Hall A. They did a double. So they're going to work Hall A and you're going to be on Hall B. You can't refuse because you don't get the assignment that you want. So that would be insubordination. And you could, of course, be fired, but you can also be reported to the state if you just, leave and you don't, have someone who covers your shift. 61. Which social media post would violate CNA professionalism? A, posting a photo in uniform without residence. B, discussing a difficult resident encounter online without posting any photos of the resident. C, discussing a difficult resident encounter online. And then B would be sharing a motivational quote. And E is both B and C. So I guess the difference between B and C is one is you're talking about a resident without photos, and the other one is you're talking about a resident with photos. So would those violate HIPAA, any confidentiality, your ethics? Would that be a violation? And you're absolutely correct. The answer is E. It would be. Discussing a resident encounter on social media with or without photos can violate confidentiality and professional boundaries. CNA professionalism requires protecting resident privacy at all times. Posting in uniform without residence or sharing general motivational content does not breach confidentiality. There were a group of nursing students who saw the helicopter, the med helicopter landing, and they took a group photo. A patient could vaguely be seen in this group photo. Someone's daughter, the patient's daughter, saw the photo and realized that that was their mother who was, life flighted over to this hospital. That group of nursing students got kicked out the nursing program. So you want to make sure that if you're taking photos, there's nothing about your company. I wouldn't even be taking a photo with my company's uniform, their emblem, their logo on my uniform. You don't want to do anything that's going to cause your good to be evil spoken of, or actually jeopardize patient confidentiality and get you fired. 62. Which situation best demonstrates appropriate use of cluster care? A, entering a resident's room multiple times for separate tasks. B, completing toileting, repositioning, and refilling water during one visit. C, skipping care to save time. D, rushing through tasks without explanation. And one of the hardest things for CNAs, new CNAs, and new nurses to understand is time management. It's going to get better, you all. But until you learn how to cluster care, you're going to be running around like a chicken with its head cut off. So when you go into that room, you want to do B. Complete as many tasks as you can while you're in that room, which is going to require you to prepare. So cluster care organizes tasks to reduce repeated interruptions while maintaining safe, complete care. 63. What is the first step the CNA should take if a patient makes an inappropriate sexual comment? A, ignore the comment and continue providing care. B, avoid the patient. C, politely but firmly set boundaries and redirect the conversation. D, leave the room immediately and refuse further care. These patients are going to say all sorts of things to you, but I'm going to need for you to see. You're going to have to set boundaries. I know you're really nice and you don't want to hurt anyone's feelings, but yet they're hurting your feelings. Okay, they're trying to touch you inappropriately. So the CNA should address the behavior professionally by setting boundaries and redirecting the conversation. Yes, you're going to let your nurse be made aware. Okay, this approach maintains a safe and respectful care environment. And once CNA tells me that a patient's being disrespectful, to them, I'm going to go and have a conversation with that patient. I'm going to notify the doctor. There are chains of action that can be put in place because we want you to feel safe at work. Let's go to our next one, team. Question 64. A resident who is not assigned to you asks for help with a basic need. What is the most appropriate action for the CNA? A, report the request to the nurse before providing help. B, ignore the request because the resident is not assigned to you. C, assist the resident with the request and inform the assigned nurse. D, provide help only if it's convenient, because you have 16 patients. You don't have time to be helping out this other patient who's called you. But you actually do. So if another resident has called, whether that is your patient or not, that becomes your patient. Okay, so the answer is going to be C. You're going to assist the resident with the request, and then, because we don't know where their CNA is, maybe they did not get assigned a CNA that day and that nurse is really busy. So CNAs are responsible for ensuring resident safety and comfort regardless of the assignment. Providing basic care prevents delays and potential harm. Informing the assigned nurse supports communication and continuity of care. Remember, we're a team. We're all in this together. If you have a great team, you can have the worst day ever. But if you have a good team, it doesn't feel as bad. 65. Which action helps a CNA safely perform an emergency drag? A, lifting a resident under their arms. B, using a blanket or sheet when possible. C, dragging the resident by the legs only. D, attempting to drag alone without assessing safety. When you're taking your CNA exam, it's about you knowing your role and being a safe caregiver. So if there's an emergency and you have to get this resident out of this facility, you have to get that resident out that house, and there's no wheelchair, there's no stretcher, there's no bed on wheels, you're going to do B. You're going to use a blanket or a sheet to help drag them. You're not going to pull on their arms or their legs because you could dislocate a joint. So using a blanket or sheet helps protect the resident and allows safer movement. 66, a resident makes racist comments towards the CNA. What is the most appropriate response? A, arguing with the resident. B, ignoring the resident completely. C, responding with similar comments. You're going to match energy. Or D, calmly set boundaries and focus on care. It could be a racist comment, a sexist comment. It could be an inappropriate joke. It could be a political comment. It could be a comment about your religion. Look, you're going to have to toughen up to be in healthcare. They're going to say some strange things to you, and you know what you're going to do? You're going to set those boundaries, and you're going to continue focusing on your care until it's just too uncomfortable. Okay, let your nurse be made aware. Remember, you have allies. You have people that you can go to. So CNA should remain professional. We're not going to match energy. I don't care how much she or he is getting on your nerves. Don't match energy. You're going to set boundaries and focus on care without engaging in conflict. 67, to ensure dignity when helping a resident with limited mobility during personal hygiene, you should A, complete the task quickly to minimize discomfort. B, request assistance from another CNA for efficiency. C, explain step by step and encourage independence where possible. D, avoid eye contact to prevent embarrassment. And in some cultures, they don't like eye contact, but this question was not talking about cultural differences. You're trying to provide dignity while you are cleaning someone, while you're giving them personal hygiene. So I need for you to do which of the following. That's right. It is C. You're going to just talk through the steps. And, maybe Mr. Lucas is okay with cleaning his own peri area. Maybe he can clean his own genitals. And, if someone's had a stroke, they can sometimes clean one half of their body with their unaffected arm, and you clean the other half. So promoting resident dignity involves explaining procedures and encouraging as much independence as possible. You need to call for another CNA. You needed to work with that patient. I remember there was this one patient who was, obese, and a CNA didn't want to provide care to her because she was so large and just assumed she was a difficult patient to turn. And so we had the bariatric bed. We had the bed that was for obese patients. This person turned herself. She was able to wash her face. The bath was quick. So don't assume that a patient can't help you. Give them an opportunity to show you what their abilities are, and just don't assume that everybody is disabled because they look a certain way. Question 68. A CNA enters the room to begin a skill. Which action is required first to avoid exam failure? A, hand washing. B, wearing gloves. C, using hand sanitizer. Or D, gathering supplies. That's right. We're going to wash those hands. So yes, you're going to introduce yourself. You're going to get their permission. But before you touch that resident, you have to wash your hands or you're going to fail your exam. And we don't want you doing that. Okay. You studied too hard. So failure to perform hand hygiene before and after resident care will result in a skills exam failure. So clean those hands before and after each skill. 69. Which action would cause a CNA to fail the transfer skill? Is it A, locking wheelchair brakes? B, using a gait belt correctly? C, lifting a resident by the arms? Or D, using proper body mechanics? Some of you all have seen the wrong thing done, or you've seen skills done the fast way, not the safe way. And when you take your test, you have to get rid of those old habits. You have to get that old information out of your head. You have to be a safe caregiver. And so we're not lifting residents by their arms. So the answer is C. You wouldn't be doing that. So pulling on a resident's arms is unsafe because it can cause shoulder injury and does not provide proper body support during transfers. This technique increases the risk of falls and injuries to both the resident and the CNA. A gait belt is what's going to be utilized. A gait belt is preferred because it provides secure support at the waist, promotes proper body mechanics, and ensures safety. So you put that gait belt on, that transfer belt on snug, do your 2-finger check, and you're going to assist the patient to stand by holding onto the gait belt, making sure they're not dizzy, and you're going to hold that belt throughout the entire ambulation process. And so we're not pulling on the patient's arms. We're using that gait belt for stability. 70. If you notice a resident's urinary catheter bag isn't draining and the resident appears swollen, you should A, lower the bag to improve drainage, B, check for kinks, then leave if none are found, C, ask if they need to have a bowel movement, D, report to the nurse and monitor for discomfort. And you're going to see so much once you're a CNA, once you're working in these facilities, and all of this will make sense one day. That's right. The patient's swollen. That means they're retaining fluid. You have to let your nurse know. So reporting issues with a catheter is crucial for timely intervention and to prevent complications like infection and urine retention. So it's just one thing if, there's a kink in it, but you're looking at your patient, they appear swollen, their stomach's distended, their legs are more swollen. Something's going on. Get your nurse in there. 71. Which action can lead to an inaccurate pulse measurement and compromise resident safety? A, counting for 60 seconds if the pulse is irregular. B, using a thumb to take the pulse. C, reporting abnormal findings. D, explaining the procedure to the resident, which could lead to an inaccurate pulse measurement. I tricked you. It's not A. You're supposed to check the pulse for 60 seconds if irregular. And for the Prometric CNA examination, anytime you're taking a pulse, you're going to take it for 60 seconds. The other exams, you'll have to look at, if you're taking a Credentia or a Headmaster exam, you'll have to look at your testing guidelines to see if you're taking it for 60 seconds or 30 seconds. So the correct response is, or the thing that you're not going to do, is going to be B. You cannot use your thumb to take a pulse because your thumb has its own pulse, and that can interfere with the accuracy, and lead to inaccurate assessment. 72. Which action may result in an inaccurate blood pressure reading? Is it A, using the correct size cuff, B, placing the cuff over clothing, C, positioning the cuff at heart level, or D, deflating the cuff slowly? I know what you see in practice, but for textbook, we're not supposed to do B. We're not supposed to put the cuff on top of clothing. So just pass your test. But when you're in the real world and your patient's, in agony because the blood pressure cuff is so tight, you're probably going to see us, either use a washcloth or put the blood pressure cuff on top of their, gown. But you're not supposed to do that for this test. So when you're taking the test, just think best practices. Clothing interferes with cuff compression and can produce false high readings or falsely low readings. So I know what you see in practice, but we're not supposed to do that. 73. I'm dyslexic today. A resident receiving continuous tube feeding is found lying flat in bed. Which CNA action is most appropriate? A, pause the feeding. B, keep the head of the bed flat to prevent bed sores. C, elevate the head of the bed. D, check residuals. A resident's receiving continuous tube feeding. So they have a gastric tube and they're laying flat in the bed. Are you concerned? Is that an issue? Yes, that's an issue. Because if they're laying flat, they could aspirate. Yes, the food that's going through the stomach could actually travel up. Okay. And if it travels up, it can actually get into the lungs. So you're going to have to do B. Make sure I have that right. Excuse me, C. Elevate the head of the bed. Elevating the head of the bed 30 to 45 degrees reduces aspiration risk. Remember, CNAs, you would not be managing the feeding rates. You wouldn't be checking the residuals. And then for most of our patients who have gastric tubes or if they have tracheostomies, there's usually going to be an order or a sign above the head of the bed that says keep the head of the bed elevated at 30 degrees at all times. So you can bring it up a little bit more, but what you don't want to do is lower it down, especially while that tube feeding is going, because you can cause them to aspirate. And so let me just go back to that. So if you have to give them a bath, your nurse would show you how to do so. Your nurse would come in and your nurse would pause the machine. So this question did not talk about a bath. You would pause the actual pump. And that way you can lay them down safely, give them a bath. But then before you resume the feeding, you would have to sit them back up again. And so if that was confusing, if you don't understand, ask your professor, ask your CNA instructor to talk to you about how do you care for somebody who has a gastric tube with a continuous feeding. 74, a resident with diabetes is walking and becomes shaky and diaphoretic, and this is before breakfast. What should a CNA do first? A, assist the resident to sit safely. B, offer juice. C, check their blood glucose level. D, notify the nurse. They're walking, they become shaky. The first thing you have to do is stop the walk. You have to get them to safety. So the answer is going to be A. They need to be sitting. So safety comes first. CNAs may not treat hypoglycemia, which is low blood sugar levels, or check the blood sugar unless trained and delegated. So you get them to safety, you call that nurse. You can scream for the nurse also. You don't always have to wait for a button. You can scream nurse or that you need help and someone will come to you, but get that patient seated because we don't want them passing out. And if a patient does begin to fall, you are to guide, you are to lower them to the floor. Don't try to break their fall with your body because they can actually fall on you. And now we have you and the patient injured, and that's not good. 75, a resident repeatedly presses the call light without an urgent need. The CNA action, which CNA action is most appropriate? A, disable the call light. B, ignore future calls. C, assess needs and set expectations. D, report the resident to the nurse. So she just keeps calling and keeps calling and keeps calling. There's never anything important. She just keeps calling and keeps calling. So what are you going to do? And your answer for every question cannot be reported to the nurse, okay? Because you have a job to do and you're going to learn how to communicate with these residents. So it's going to be C. You're going to assess needs and set expectations. So addressing unmet needs, such as clustering care. Mrs. Lucas, I do understand that you've been pressing this button a few times. So is there anything I can get you now? Because I won't be able to come back in your room for an hour. I have to give a bath. I have to go transfer this patient. So it's going to be a little bit. Let me get everything you need now. Would you like to go to the bathroom? Would you like some water? Is your TV show on? Would you like some coffee? Cluster that care. And that often reduces repeated call light use, okay? 76, which behavior may indicate depression in a resident? A, withdrawal from activities. B, increased energy. C, improved appetite. D, frequent laughter. Which behavior may indicate depression in a resident? That's right. It is A, withdrawal from activities. So social withdrawal is a common sign of depression. And so with your elderly patients, they may stop playing bingo. They may stop knitting. They may try to stay in a room all day. They may start eating little. So you're going to be the one who can, actually observe those, make those observations and notify the nurse so we can get someone, your nurse, of course, will talk to them, but sometimes they do need mental health therapy. 77, a CNA is assisting with feeding when a resident pockets food in their cheek. What is the best CNA action? A, continue feeding slowly. B, stop feeding and cue the resident to chew and swallow. C, leave the resident and notify the nurse. D, squeeze the resident's cheeks to encourage them to spit the food out. I know, no, don't be squeezing their cheeks. I know they're not a toddler, you all. So B is the correct response. So pocketing food increases aspiration risk and requires immediate intervention. So you're going to stop the feeding. Don't feed them anything else because they're not safe to feed. They're pocketing the food. That's the first thing. Stop feeding them. And now you're going to cue them, chew, Mrs. Lucas, chew your food, chew your food. Here's some water. Let's get you to swallow that down. You would not leave the resident who still have food in their mouth alone, especially if they're at risk of aspiration, in order to notify that nurse. So what you do instead is once this person has pocketed this food in their cheek and they're not swallowing it, and you're trying to cue them, you're trying to get them to swallow it down, you're now going to call the nurse and stay with that resident while you're still in the room with them. Just stay with them until the nurse gets there, because if you leave them, they can actually choke while you're not there. 78. A CNA is caring for a resident with a tracheostomy. Which observation requires the most immediate attention? A, dry skin around the stoma. B, pink, moist stoma. C, increased work of breathing. D, trach ties are secured. Which observation requires the most immediate attention? That's right. If you notice that your trach patient is having increased work of breathing, they have labored breathing or difficulty breathing, that's a medical emergency. So that may indicate an airway obstruction, which means they can have a mucus plug, and that is a priority safety concern. 79. Which CNA action best supports airway safety for a resident with a tracheostomy? A, changing the tracheostomy tube. B, ensuring the trach ties are secure but not tight. C, adjusting oxygen flow. D, removing secretions with suction, meaning that you're putting the catheter in their tracheostomy and you're providing tracheal suctioning. So which CNA action best supports airway safety? And that's right. Pretty much the only thing you can do is when you go into that room, you can look at their trach. You can make sure their ties are secure, but not too tight. You'll know when they're tight because they'll leave an indentation in their neck, kind of like how tight socks leave an indentation in someone's legs. So securing trach ties helps prevent accidental dislodgement. CNAs do not change tubes. You don't perform tracheal suctioning, and you also do not adjust oxygen. Those are all nursing duties. 80. Which finding is expected when observing a healthy colostomy stoma? So we went from a tracheostomy to a colostomy. So we went from the neck, now we're in the abdominal area. Would a healthy colostomy stoma be A, pale and dry, B, bluish in color, C, covered with stool, or D, moist and pink? That is right. No, we don't want it covered in stool. That's going to irritate it. The stool should be dropping down into the bag. So the answer is going to be D. It should be moist and pink. A healthy stoma should be moist and pink, or kind of like a beefy red in appearance. And so that's what it should look like. And that is an image of a colostomy, the stoma, without the bag being on. 81. Which of the following is an objective observation? So you have to know objective versus subjective. Would it be A, Mr. George's oral temperature is 98.6. B, Mr. George says he feels warm. C, Mr. George appears ill. Or D, Mr. George reported feeling feverish, which means he felt hot. Right. So an observation is actually measurable, excuse me, an objective observation is measurable data. And so that temperature, that blood pressure, the heart rate, those are measurements that will be objective versus subjective. That is something the patient said. So objective observations are measurable and factual, like a temperature, as opposed to subjective statements. 82, an IV pump is beeping while the resident is resting quietly. What should the CNA do first? A, silence the alarm. B, check the resident and IV tubing. C, turn off the pump. D, ignore the alarm. E, immediately notify the nurse. We're getting a few answers here. I'm going to tell you why the answer is not E, not initially. Because you're in the room, the patient's arm could be bent. It could be causing an occlusion. So just simply repositioning, putting the pillow under the arm could stop the IV from beeping. So it's going to be B. You're going to check the resident and the IV tubing. So CNAs assess the resident and obvious issues such as kinks due to positioning before anything else. And now once you have repositioned that arm and that IV is still beeping, that's when you would call the nurse to come in to assess. You do not touch the IV pump. Or excuse me, you don't make any changes. You don't pause the IV pump. Your facilities usually will not allow a CNA to do so. 83. Which CNA observation suggests constipation rather than fecal incontinence? So those are two opposites, constipation versus fecal incontinence. A, frequent loose stools. B, involuntary stool leakage. C, skin irritation around the anus. D, abdominal discomfort and infrequent stools. Which observation suggests constipation? That is right. It is D. So if someone has abdominal discomfort, that's due to the stool that is still within their colon. And the infrequent stools, the stool is hard to pass. So constipation presents with infrequent difficulty stools and discomfort. 84, you have a resident with a tracheostomy who cannot speak. Which CNA action best supports communication? A, speak louder. B, ask only open-ended questions. C, use a communication board. Or D, answer questions for the resident. So not all patients with a tracheostomy have a speaking valve, okay? Especially not in the hospital because this could be a newly placed tracheostomy and it may take days or weeks before they're able to have their speaking valve placed. So right now you have a patient with a trach and they cannot verbalize their needs. How do you best support communication? Yes, it's going to be C. We're going to use a communication board. And on the next slide, here's an example of a communication board. And so we have our check, we have our X for yes and no. You can also ask your patient to give you a thumbs up, thumbs down. You can have them nod their head yes or no. They can point to the toilet if they need to use the restroom. If they're hungry, they can point. And so this just isn't for somebody who is nonverbal with a trach. It's also for somebody who speaks a different language. So your hospitals have communication boards. And if not, go ahead and download our test packet either from our website, fltraining.com, or from our YouTube store. And that way you can download the slides so that you can have your communication board also. And so this is how a patient would communicate with you if they're not verbal. They can just point instead. 85. What does it mean to burp a colostomy bag? A, gently releasing trapped gas from the pouch. B, removing the pouch from the stoma to allow the stoma to get some air. C, cleaning stool from the stoma. Or D, irrigating the colostomy. What does it mean to burp a colostomy pouch? That's right. You are learning new terms today. Absolutely. You all, when a patient with a colostomy, if they eat beans or something that produces a lot of gas, remember they're not able to pass their fecal matter or their gas the normal way. It's coming through their stoma. And so with that bag, all the air, the gas can become trapped, and it's going to cause your patients discomfort. They're going to start cramping. How do you feel when you can't pass gas? And so whenever we are burping a colostomy pouch, we are just removing the bag or opening the bag to allow the trapped gas to escape. That's going to help reduce pressure, the ballooning or that outpouching, and it's also going to help with the patient's discomfort. Most of your facilities do not allow air freshener. So a lot of our nursing staff, whenever you're taking care of patients who have colostomies, you want to go in and wear a mask and all these other things. I'm going to ask that you don't do that. I'm going to ask that you don't do that, that you're going to have to learn how to control your facial expressions. Why? This patient already has, a image, a disturbance complex, and now you're going in. They don't have any respiratory issues. You're going in with a mask because you don't want to spill their fecal matter. Meanwhile, you're leaving them in the room, sitting there with it, and they don't have any air freshener either. And so you're going to use your empathy. This patient could have had, colon cancer. Maybe they were shot, a motor vehicle accident, and now they have this colostomy. They have to learn a new way of life, and you come in wearing a mask. Don't do that. Okay. Nurse Eunice pet peeve, don't do that. If the patient does not have a respiratory issue, you're not going to be wearing a mask in their room. 86. Yes, I hope you have the pen and the paper that I asked you to get earlier, because now it's time to do some math. A resident drinks 6 ounces of juice. Approximately how many milliliters or mLs should the CNA record? And the ratio that you have to learn as a CNA is 1 ounce is the equivalent of 30 mLs. So it's a 1 to 30 ratio. 1 ounce is 30 mLs. 2 ounces would be 2 times 30 would be 60 mLs. Your patient drank 6 ounces. How many mLs did he or she drink? All right, I'll give you about 30 seconds. And I'm so proud of you all for staying this long. We're almost on question 100. Remember, my goal for you this year is for you to earn your CNA license. And once you earn that license and you pass that test, come back and let us know that you passed. We appreciate you so much. We would not be here if it wasn't for viewers and subscribers like you. So thank you, and thank you. And for anybody who did 6 times 30, you know that the answer C, it is 180 mLs. There's our rationale, and there's our step-by-step breakdown. The resident drank 6 ounces. Each ounce equals 30 mLs. You will multiply 6 by 30, which would be 180. But we have to put our units of measurement. Look, when you're taking your CNA test and you have to document urine output and you don't put mLs or cc's behind that number, you will not be successful. So don't forget, getting the number is not enough. Get the number and put the unit behind the number. So proud of you. Great job. Give yourself applause. 87. When is the best time to collect a sputum specimen? A, immediately after meals. B, early morning after the resident wakes up. C, in the evening before bed. Or D, after oral care with mouthwash. When's the best time to collect a sputum specimen? First thing in the morning. So the answer is B. Yeah, we don't want them brushing their teeth or anything. We want the germs that have been sitting there all night and just festering. And so early morning sputum is more concentrated and provides the most accurate specimen. So you'll have the cup in the bathroom, get them up in the morning, have them sit up. And, as you take them to the bathroom, you hand them the sputum cup. Make sure they know it's for sputum and not for urine, but hand them the sputum cup so they can go ahead and they can cough and get that morning specimen, and then you can take it to lab. 88. Which of the following is a legal responsibility of a CNA? A, supervising other CNAs. B, teaching other CNAs. C, mentoring other CNAs. Or D, none of the above. I know what you saw in practice, but it's D, none of the above. That is not within your scope of practice. The nurses delegate, the nurses supervise, the nurses teach. So CNAs are not authorized to supervise, teach, or mentor. I know what you see in the facilities. I just need you to pass your test. They focus on providing patient care under the supervision of a nurse or an advanced healthcare practitioner. That can be a nurse practitioner, it could be a physician's assistant, it could be a doctor. Remember, not all CNAs work in a hospital or nursing home. Some also work in clinical settings. 89. Which CNA instruction best helps a resident provide a clean catch urine specimen? A, collect the urine as soon as voiding begins. B, stop the urine flow before collecting. C, clean the perineal area and collect urine midstream. D, collect urine from the toilet bowl. If you do D, just go ahead and don't even take the CNA test. I love you, but so we say we want a clean catch urine specimen. We're catching something. Think of a ball that's being thrown in the air midstream. So the answer is going to be C. They have to wipe. And so usually your clean catch kit is going to look like this. It's going to be in the bag. You'll take out the items. They're going to wipe themselves first so we can get rid of some of the germs. They're going to start urinating to wash away any germs that are left on the urethra. And then they're going to place that cup beneath them midstream to collect the midstream urine. And that's how we can collect the urine specimen that has less bacteria from the skin. 90. A resident weighs 154 pounds. Using the 2.2 method, that's the hospital method, easy calculation, approximately how much does the resident weigh in kilograms? I know you dislike conversions, but you have to know them. So our medications are weight-based. So when we tell you to put the patient on a scale and to get their weight, you're getting the weight in pounds, but we need a way to quickly convert that to kilograms. So that would be the 2.2 method. Now, if someone weighs 154 pounds, are they 338.8 kilograms, 60 kilograms, 65 kilograms, or 70 kilograms? So it said, I don't know. All right. And so when kilograms are approximately half of what the pounds would be. So the 2.2 method is whenever you know the pounds, you divide that number by 2.2, and thus you would get D, 70 kilograms. And again, as a CNA, you don't really, you're not too concerned about that. But as a nurse, I need to make sure that when I'm giving this patient their medications, I'm not over sedating them. I'm not giving them medications that their body organs can't tolerate, their kidneys can't tolerate. And so a lot of our medications are weight-based and is based off of kilograms, not pounds. And that's why we have to have you do those conversions. Question 91, and we've almost been here for 2 hours. I am so proud of you. 91. A CNA measures urine in a graduated container. The urine level appears slightly below the 500 cc mark, but clearly above the 450 cc mark. How should the CNA document this output? Is it A, 475 cc's, B, 425 cc's, C, 450 cc's, or D, 550 cc's? I told you this is the best CNA practice test for 2026. Yes, I will have more, but I want to start off with a long one for the beginning of the new year. And that way I can make sure that you have enough time to sufficiently study. All right, this one's tricky. Here we go. Look at that urine mark. It's between 450 and 500. The little line in between 450 and 500 would represent what? It's in increments of 25. So if you said A, 475, you have it. That is the correct response. And so whenever you are taking your CNA examination with Prometric, usually you're allowed to be 50 cc's away or 50 cc's off. You have a range. And so anything between 450 and 500 would have been accepted, but I did not give you 500 as an option. I gave you 475. So when the level is between 450 cc's and 500 cc's, documenting 475 cc's reflect accurate estimation within the accepted range. Don't forget, you have to put cc's or mLs behind your output for your CNA examination, or you might fail your test. 92. A resident has a Jackson Pratt or a JP drain after surgery. Which CNA action is appropriate? A, emptying and measuring the drainage as directed. B, reinserting the drain if it comes out. C, changing the insertion site dressing. D, suctioning the drain tubing. And for those of you who have never seen a Jackson Pratt or a JP drain, I'll show you on the next screen. Again, as a CNA, you're going to learn so much. You're going to learn a lot about the body, a lot about medical procedures. You're going to learn how to communicate with patients, families, nurses, doctors. It's also going to teach you whether or not a career in nursing is going to be good for you. Okay. And so 92, the answer is, of course, A. And so these are the JP bulbs, okay? And what they do is they evacuate, they drain fluids. What kind of fluid would a person have after surgery? Blood, okay? So CNAs may empty, measure, and record JP drain output. However, reinsertion, dressing changes, and suctioning, all of those are outside of the CNA scope of practice. Usually if we do connect those to suction, it must be something major going on. That patient's going to be in ICU. They're not going to be on the regular floor. 93. Which JP drain finding should the CNA recognize as abnormal? A, small amount of light pink drainage. B, gradual decrease in output. C, sudden increase in bright red drainage. D, drainage present in the bulb. Which of these would be abnormal? That's right. If there is a sudden change in anything and this doesn't appear to be an improvement, you're going to get your nurse in the room. So it is C. We shouldn't have this sudden just increase in bright red drainage, aka blood. Post-op day 1, so the first day, first 24 hours, that should have the most blood being drained. And you're emptying that bulb and then recompressing it every time it's halfway filled. So if on your shift on post-op day 1, you emptied it twice, you document it, beautiful. Now on post-op day 2, you shouldn't have twice that much drainage, so it should gradually over time be less and less drainage until there's no more drainage, and then the doctor can come in and remove those drains. 94. What does the term emesis mean? Is it stool, vomiting, sweating, or urine? Emesis. Say it with me. Emesis. If you chose B, you are correct. And so emesis is the medical term for vomiting. Why do I have that brown circle on the screen, you all? Because some of your patients would have coffee ground emesis. They would have brown emesis that looks like coffee. That is the sign of a gastric bleed. That would be digested blood being brought back up. I don't need you panicking and freaking out the patient. I need for you to know that if vomit doesn't appear to be food colored, if it's green, that's bowel. But just like you have to learn about the different colors of urine, the different colors of stool, you have to learn about the different colors of emesis. And if it doesn't look natural, if it doesn't look normal, that's an emergency. You're already going to be calling your nurse into the room because the patient vomited. But when you document it, it won't say how much vomit did the patient have. When you document it on the INO form, it's going to say emesis. And so you document the amount of emesis and also the color. You need to know that that's bad. Don't stress your patient out. Get that nurse into the room, and the nurse will, of course, come in and assess, call the doctor, get some labs and some procedures ordered so that we can find out why this person is bleeding internally. 95, a resident experiences emesis. What is the CNA's priority action? A, offer food immediately. B, offer fluid immediately. C, measure vital signs. D, position the resident to prevent aspiration. One of the worst patient experiences I ever had was a patient who had cirrhosis of the liver, and he was in the medical ICU, and we gave him medication to decrease his ammonia levels, and he had a bowel movement from his head to his feet. I laid him flat, and as soon as I laid him flat, he started vomiting. He aspirated, you all. And so that was so traumatic. I still think about that patient to this day. So whenever a patient starts to vomit, you're never laying them flat. Unfortunately, he was flat when he started vomiting, laying in pool of fecal matter, but we had to get him to his side as soon as possible. Okay, so if your patient can tolerate sitting up, you can sit them up. This patient was unconscious, so I couldn't sit him up. I had to turn him to the side. But you repositioning your patient once they start vomiting is going to help prevent aspiration or the worsening of that aspiration, and it's going to help protect their airway. 96, a patient with prolonged bleeding after a small cut might be prescribed which type of medication? A, vitamins. B, insulin. C, anticoagulants. D, antibiotic ointment. So while you don't give medications, you have to know about medications. And so if your patient's bleeding and they just have a small cut on their finger, you're like, why are they bleeding so much? It's just a small cut. It's probably because C, that's right, they're on anticoagulants. And so earlier we mentioned a patient who you put tape on their face because their oxygen, they were taking their oxygen off and on. Well, when they have thin skin like this, it's a sign that not only are they, a bruiser, they're also a bleeder. And so when you go into your patient's room and you see somebody with ecchymosis, the red in areas on their skin looks like they've had previous skin tears, that should, one, let you know that you have to prioritize safety, because if they fall, if they injure themselves, they're going to bleed. Two, that they're probably on an anticoagulant or a blood thinner. So anticoagulants are medications that slow down blood clotting, which can cause prolonged bleeding even from small cuts. Patients taking these medications may bleed longer than usual and require closer monitoring for bleeding, and require you as the CNA to perform every skill safely, to turn them slowly, to not tear their skin, because if you do, they're going to have a harder time. We're going to have a harder time controlling the bleed, number one. And then number two, their skin is just going to be tore up. So the care that you provide actually matters. '97, which documentation entry is most appropriate for a CNA? A, resident had 200 mLs of emesis. B, resident vomiting due to anesthesia. C, resident appears dehydrated. D, resident condition worsened. Remember, objective versus subjective. As a healthcare professional, we document objective assessments and findings. It's not about what we feel, not about what we think. And so it is going to be A. The resident had 200 mLs of emesis. So CNAs document objective, measurable data, not diagnoses or opinions. Remember, you don't diagnose. 98. What is a CNA's top priority when caring for multiple patients? A, time management, B, self-determination, C, completing tasks quickly, or D, safety. Yes, yes. I know you want to be prioritizing time management, but that comes second to you keeping your patients safe. So the answer is D. Patient safety is a primary concern as it prevents harm and ensures well being. Question 99. A resident with chronic kidney disease is on a renal diet. Which food choice should the CNA recognize as not appropriate for the resident? Is it A, white rice, B, apples, C, pancakes, or D, bananas? And I've not eaten yet, so all of that sounds delicious. Which food choice, if someone has chronic kidney disease and they're on a renal diet, which of those should not be on their tray? That's right. Bananas are full of potassium. And whenever someone is on a renal diet, they have to limit the potassium because their kidneys are impaired and they can't excrete that potassium. So, what happens if someone has too much potassium that's not excreted? They can go into cardiac arrest. It causes their heart to beat irregularly. So, CNAs must support renal diet management by recognizing foods high in potassium, phosphorus, and sodium. So when you see them bringing, they're sneaking a little bit of orange juice or trying to eat all these other things, you can try to re-educate them, but then definitely, tell your nurse because if you don't tell me, I don't know they're sneaking it. But all I know is that this patient keeps staying sick and they keep having to come back to the hospital for dialysis. So we help each other. You don't have to confront a patient. You have to tell your nurse so that your nurse can go in and just ask those questions. Nurses are great investigators. We just need a little bit of help from you to know what's going on with our patients. Question 100. We did it, team. A resident requires a blood pressure measurement. One arm has a severe burn and the other arm has an IV in the antecubital area that's in the bend of the arm. What is the most appropriate action for the CNA? A, take the blood pressure on the arm with the IV. B, take the blood pressure on the burned arm. C, use the forearm or wrist according to facility policy. D, skip the blood pressure and document why. Oh, yeah. I'm looking at all these answers. I am so proud of you because you understand that we cannot take the blood pressure on the arm that is burnt or the arm that has a AV fistula, their dialysis site, or the arm where the person has had a mastectomy. So instead, it's going to be C, the one arm that we have that is usable. You cannot put the blood pressure cuff above the IV because that would blow the IV. Some of your facilities will allow you to go below the IV, the forearm, or they will have wrist blood pressure. An AV fistula, which is the dialysis site, or above an IV. Using an alternative site, such as the forearm or wrist, following facility policy, talk to your nurse, supports patient safety and accurate measurement. And if that doesn't work, we can also take a blood pressure on the calf. Talk to your nurse if you need help with that. Guess what, team? I am so proud of you. We did our 100 questions. Let's go over our bonus question. How can viewers best show their support for me, Nurse Eunice, and Florida Training Academy? A, by buying our new CNA exam prep study guide. Both discounts are available for schools and educators. Hint, hint. B, purchase the printable version of this practice test that says for $6 is $7. C, like, share, comment, and subscribe. Or D, visit our our website, fltraining.com, for class schedules, our CNA exam prep book, and downloads, or eat all of the above. That's right. It is E, all of the above. Supporting us, myself, and my business through engagement, sharing, and purchasing resources helps advance our borderless classroom and expand access to high quality, affordable healthcare training from learners worldwide. Look, I spent 2 hours with you all, and I just love it so much. I want you all to pass your exams. I want you to be successful. I want you to be the best caregivers possible. And if you would like, yes, we have our YouTube channel memberships. You can join at the Study Buddies level for $4.99 or the Scrubs and Ambition level. And what I do for my shorter tests is I make sure that I upload those tests into the post so they can actually download the tests so they can not just see them on so practice on their own. And so there are perks to being a member. We do appreciate our members, and I just want to say that caring CNAs make or become caring nurses. So you're doing this the right way. You're starting right now. I know it feels like you're starting all over again or you're starting at the bottom, but don't look at it that way. You're starting off fresh. The facilities are going to love you. You are not tainted. You don't have any bad habits, any bad techniques. You're going to learn the skills. You may even go to nursing school, or you may decide that nursing school isn't for you, and you may want to be an occupational therapist, a physical therapist, a case manager. Look, the door is wide open. We just need you to get in. So get in. Remember, this race is yours. You're not competing with anybody, and I know that you're going to do well. Thank you for watching. Thank you for subscribing. And I love you. Have a blessed day. And congratulations on passing your CNA exams. Bye, everybody.